I'm ready. Looks like our anchor's getting ready to toss it over to you, so, yeah.
Happy Tuesday, everyone. Welcome. This is Jen Rumbalski from the La Crosse County Health Department, and I have some updates to share with you today. First of all, our case number in the state of Wisconsin is now at 457. That is 41 more than we had yesterday. The total number of tests that have been conducted thus far in Wisconsin is 8,237, which is up from yesterday by just under 1,200. In La Crosse County, as we've been talking about, we've been having tests conducted in this county, and we knew that we would have an increase in cases. I will tell you that we do have 5 additional lab confirmed cases, and those have all come in within the morning here. In fact, a couple of them in the last hour. So our staff is already on top of investigating those cases, but I will share some information with you about each of those cases. The first case is in an individual who is male, in their upper 20s. The symptoms started during the week of March 9th, and the individual had symptoms that got worse and went in for testing on March 23rd, and the test came back positive today. The second individual is a female in her lower 30s. She does have recent travel history to a domestic location that we know to have a lot of cases. The third individual is a male in his upper 70s. That individual is experiencing mild symptoms and does not have a fever at this time. And the test was done on March 23rd and came in today. The fourth and fifth cases are both females in their lower or upper 30s, lower 40s. And all I have at this moment is that they are, we do believe that they are a direct contact to a lab confirmed case. So we are currently working on details relating to all 5 of those cases and have our investigation team actively working on communicating with those, and we will let you know as soon as we know more, especially if it relates to the health of the public in a way like we've done in the past with any notifications. Next, as you all know, we have received an order from the governor called the Safer at Home order. And that order does talk about a number of items, but specifically that we are being asked to stay at home. And we have been talking about this for some time now. The order will go effective at 8 a.m. tomorrow morning, March 25th, and will remain in effect until 8 a.m. on Friday, April 24th, or until a superseding order is issued. We can post a link to this particular emergency order on our website, lacrossecounty.org, COVID-19. And then we also know that there are a number of business-related aspects here. So I will just point out that if you are not identified specifically as a business that is exempt from the order, there is a list of those businesses in the order itself. If you are questioning whether or not you are exempt, you are asked to contact the Wisconsin Economic Development Corporation. Again, we'll put a link to that on our website. The next thing I want to talk about is to recognize that we do have students from our local campuses that are coming back from spring break at this time. We have been in contact with UWL in particular, and we are working to make sure that those students are aware of the symptoms, aware of the risks, and understand that this is very serious and that we need to make sure that we are not spreading COVID-19 in our community. So we are working to assure that that message gets out and to, like we have done in other situations, have a form for them to self-identify if they have symptoms, if they have traveled, so we can be in communication with them. Some of these individuals will be going to communities outside of La Crosse County. Some of these individuals will remain in La Crosse County, and we want to make sure that we can be in contact with them so we can provide specific guidance that pertains to their situation. In particular, we would just want to use this moment to say that we recall that mild symptoms are potentially causing this spread of COVID-19 more than we previously thought. So do take mild symptoms very seriously. It means that you need to be home, and we're all going to be home anyways, so the message doesn't change. But you only need to do anything different than being home if you are experiencing symptoms that require contacting your healthcare provider, and in that situation you would call before you would go in. And again, if they're severe enough, and you would need to call 911 in those situations. Otherwise, mild symptoms, moderate symptoms, the message remains stay home. We are aware that the National Guard is working on helping with personal protective equipment through a buyback program that is launching tomorrow. In addition, I want to talk a little bit about masks. We've had a lot of individuals in our community who are willing and able to assist in the response to COVID-19, and we're really grateful for that. But we do want to have a coordinated community support effort to make sure that it is not causing unnecessary burdens on portions of the response system. So masks in particular, if you are someone who is a seamstress or willing to make masks, please know that we don't yet have the guidance, that we have not finished compiling our research around what types of masks would be best. We also are assessing the need. We're contacting long-term care facilities and other facilities to find out what is really needed. We want to have a match in terms of what types of personal protective equipment is needed, who needs them, and then we can have a coordinated effort to get those to the locations where they're needed. Again, I would just reiterate, not making masks yet until we can give you some guidance on the best type of mask to make. However, what we would like you to do is to send us an email, and that is COVID-19, COVID-19 at lacrossecounty.org. That is our email address, and we would want you to send us an email with something in the subject line that pertains to what you are willing to supply or donate or assist with, and we will work to coordinate that effort. So if, for example, you are a seamstress and you want to provide assistance with masks, put masks in the subject line, and we will have someone that will be working on coordinating that effort. We are grateful for those out there who have the ability to help in some way. So that is the best way for you to reach out to us right now. And lastly, I will just mention we have heard, again, continued questions around particularly testing and who gets tested and who does not. We can talk more about that specifically tomorrow when a rep from Mayo and Gunderson is with me during our press conference tomorrow. But I will just say we continue to have prioritized testing for those that are in the hospital with severe illness, as well as those that are healthcare workers, particularly with symptoms of COVID-19, because those are the ones that are either at the greatest risk of severe disease or even worse, or those that are at the risk of transferring the illness if they are sick. So with that, I think I'll take questions and answers that you have for me at this time.
Relating to the orders that Governor Evers kind of sent out, he said that people are still able to kind of go outside for a short amount of time and whatnot. I guess when you're outside, how many people can be with you from your household at once?
Good question. So the question is, if you go outside, which is allowed under the order, how many people can be with you? So if these are individuals that are already in your household, you can be with members of your household. I think that would typically be under the amount of the numbers of people we'd be concerned about. So that is okay to be with members of your household, and we do just want you to be cautious about when you're outside, that you're avoiding being in congregate settings, and that we think about things like contaminated surfaces, even playgrounds, things like that. We would want to just be in the backyard or doing things in a way that it is safe for us to be doing.
How long should you be outside for?
I think it's, I think we need to be outside. The question is, how long should we be outside for? We need to be outside right now, but do balance that with being at home. That is the order, that we are to be at home. So just balance that and know that being outside is good for our health as well, but you have to be planful and thoughtful about making sure that you don't put yourself in a situation that puts you or others at risk.
Jen, I know you're in close contact with some of our neighboring counties, Monroe, Trempealeau, Vernon. Have you heard anything, any new confirmed cases out of them so far?
So the question is, any surrounding counties, have we heard any cases from them so far? So I have not at this point heard about cases. We again know that many tests are being conducted in our healthcare systems, which serve the entire surrounding area. So we expect that there would be tests surrounding us at some point.
And then you may have answered this, but in the new 5 cases, do we know if we have community spread yet?
Good question. The question is, in the 5 cases we have, do we know if we have community spread yet? We do not know that yet. If in the course of the investigation of those cases we determine that, we will let the community know through the media immediately.
And in terms of making masks, there are some volunteers out there who have already started making masks. So what do you say to them?
So what do I say to those that are starting to make masks? I say I am grateful that they have those skills and are willing to help, really grateful. However, we want to make sure that the types of masks that we are making are the best that we can be making, because I would not want someone to put all of their time and energy into such a product that then cannot be useful. So I would ask if people would wait for the guidance that we can provide. We're hoping to do that tomorrow. That way we know what kind of insert to put in between the type of material. We can provide further guidance about all of the aspects relating to those masks. Again, I think it's wonderful that individuals in our community are willing and able to help with that. We just want to make sure that they can be utilized and done so in a way that helps our community.
Mm-hmm. And the county health department as well, from what I've heard, is that they're starting to think of having volunteers making these masks. So what can you tell me about that?
So the question is volunteers making these masks. So again, it comes back to we'd really like to wait until we know what the guidance says about the types of materials, the way to clean and disinfect those masks, guidance to give with the use of them and how to assure they're fitting properly, and that we know where they're going to go so they can be used and not be sitting somewhere waiting to be used. So my guidance would be that when we get that figured out, which should be in the next couple of days, again now send us an email to let us know that you're interested and able to help with that, and then we will coordinate that effort to assure that they are they're made in a way that will be helpful and that we can get them to where they need to go.
Could you sort of lay out why this stay-at-home sort of order is essential, and how the sort of chain reaction of how this could spread throughout the community if you aren't following these sort of guidelines?
So the question is, why is the stay-at-home order so important, and how does it help with spread, right? So let's go back and think about how COVID-19 is spread. We remember that this is spread through droplets when someone who is ill, coughing, putting droplets into the air. When you're within 6 feet of someone who has a cough or is touching contaminated surfaces, and you come by and touch that surface, we can pick that up. It can get into our mouth, nose, eyes, and we can become infected with the virus ourselves. And that is how the virus spreads. And so if we are at home and we are not in contact with other individuals, so we're not going to stores and touching things, and we're not in close contact with other individuals, this type of an order is meant to assure that the risk level for the spread of this particular virus is minimized to the point that we can stop cases from continuing to go from person to person.
A lot of people have sort of been concerned about eating food from a takeout restaurant. I know we are trying to support small businesses, but is there a risk in sort of eating takeout food prepared by someone else?
Question, is there a risk with eating takeout food prepared by someone else? No, there's not a risk. So we know our restaurants and businesses, we inspect those businesses through our department even. We have great relationships with them. They follow very good protocols with regards to health and safety to assure that they do not cause illness for other individuals. That's something they do every day. And so we absolutely can rest assured that those takeout items are safe for us, and they are also helping our local businesses to have some income in a time that's really difficult for them. So we would absolutely indicate there is not a risk there.
I know we want to limit our travel as much as possible right now, but what happens for some of those people in the community that have maybe 2 residences that they maybe go back and forth to, or like a cabin or just another home?
So the question is, what about someone who has more than 1 residence and usually goes back and forth between them? The goal right now of this order is that they not do that we stay in one spot. If we're, especially if it's, like we're hearing about communities north of us, if individuals have cabins and they're going to those communities, if you get sick and you're at your cabin, those communities have very small hospitals sometimes. So think about how that might impact the community if you were to get sick in that location. So pick 1 residence and stay there and limit your travel as much as possible. And if we do our part, this will make a difference.
In terms of limiting your travel, I guess how far is too far to go in terms
So
of
the
travel?
question is, how far is too far to go in terms of travel? So let's remember that what we're being asked to do is to stay home, and that essential travel is what is permissible here. And that essential travel is, do I need to go to the doctor? I call the doctor, I can go to the doctor. Do I need to go pick up my medications at the pharmacy? I can do that. Do I need to get groceries and I can't order it online? I can go to the grocery store and get the groceries that I need. There and back, so that we are not traveling and doing a bunch of errands and staying home as much as possible. So it really should be limited to essential travel.
College kids might be coming back and now moving back to their hometowns. What are some sort of things that they can do to sort of stay safe if they are moving back to their hometowns and leaving La Crosse to go where they live?
So the question is, what can some college students who might be coming back to get their items and then going back to their home communities? I think it would be the same message as everyone. They need to get home and they need to stay home. We don't want them out and about in the community. They cannot be out and about in the community after this order goes into effect. And we want them to think about that, even though currently it doesn't show that young people are getting very severely ill, that they can be a vector of this virus to others, and we need them to be to stand up and be a part of our community, just like the rest of us are all working to do. And we all have to do our part, and that includes those that may have traveled and are coming back and might be at higher risk than the normal population who hasn't traveled recently. So we just encourage them to think about this in a serious way, recognize that it's about more than them as a person. It's about our community and our friends and neighbors as well, and that they need to get home, stay home, and not be out traveling.
And you mentioned that further research needs to be done in order to start accepting masks. Do you have any general idea of maybe when the county health department can start accepting these masks?
So the question is, when could masks begin to be accepted? So what I can tell you is that our goal is that tomorrow we're able to provide guidance on what those masks should be made out of, what type of insert should be in between the fabric in terms of making sure it's filtering particles. And we hope to get that guidance out tomorrow. From that point forward, then we will provide additional information about how that coordinated effort will go forward.
Jen, there's a couple of letter writing campaigns going on right now for nursing homes, folks who are stuck in and pretty much quarantined down. Do you advise against that, for that? Because I mean, there's a possibility, I would assume, of spreading. If somebody were to receive a letter and potentially have it, what would you say about that?
So the question is about letter writing campaigns and the potential that it would be a contaminated surface and spread the virus. So I can look into that. I'm not aware of any evidence that type of a surface would, that the COVID-19 virus would be on that type of a surface. But I would just encourage those that are writing letters, which is a wonderful idea to help support the social needs of those in our community, that if they are sick, they really should not be doing that. They should not be holding the pen and writing the letter. They should leave that up to someone else or utilize a computer, for example. So I think there are ways to get around that and make sure that they're safe, but I don't know of any evidence that indicates paper is a contaminated surface, but I'll certainly check into that.
How can people prove what they're traveling for if they get stopped?
How can people prove what they're traveling for if they get stopped? So I'm not yet aware of what is going to happen in the community relating to what I've heard in other states around vouchers. And if this came out on the press conference, I have not heard about it. So I'm not sure if law enforcement will ask for you to provide something, but again, we shouldn't even have to think about what we would need to provide, because if we are someone who is traveling to and from an essential position, such as public health or health care, we should be able to explain that. We should have a badge. We shouldn't really need to worry about that. If you're worried about that, I would ask, I just want you to not be traveling unless you are really needing to do that for essential travel reasons.
Absolutely. And then how many times per week should somebody go to like a grocery store?
So the question is, how many times a week should someone go to a grocery store? So I think let's be prudent and think about limiting our exposure to others. If you can plan ahead, if you have a large family, for example, that eats a lot of food, I totally get it that you want to have fruits and vegetables. You may need to go once a week. I would be thinking that more frequently. Please try to be planful and get what you need so that you don't need to be there frequently, multiple times a week. Hopefully would not be necessary. The goal here is to limit travel. So if we're doing our part, we would want to know what we need, get in, get out, or order it and have it put in our car, and be limiting that exposure. There's a reason for this order, and really it is just about doing the best we all can to make sure that we are not spreading the virus.
You don't think these cases are from community spread? Do you have any idea sort of where these people got this virus?
So the current cases that we just got in, where did they get the virus? So these are very freshly coming to our department, and so in terms of what I know about them is somewhat limited. But what I do know is we think that 2 of them were a direct contact to another confirmed case. And then there was one that did travel to what we would call a hot spot in the United States. The others, we don't have enough information yet to indicate where they may have gotten the virus.
And going off that, do you think that as far as a timeline here, if people start obeying these orders and do staying at home, will life go back to normal sooner rather than if they don't? What's the timeline of this sort of look like if people start doing what they need to be doing here?
So what does the timeline look like in terms of this order, and will it impact in a way that we don't have to continue to do this longer and longer? Yes, if you understand how disease works, if you're talking about a disease that is transmitted person to person through droplets by close contact, potentially on inanimate objects, when you reduce the chances that individuals are in close contact with each other, you absolutely make it much more difficult for the virus to go from person to person. So the more effective we can be with staying home for a time period, I know it's difficult and it's definitely a disruption to all of our lives. If we do this and we do it well, we will see those case numbers be lower, and we will see that we will not have as many people dying in our state and in our nation from this illness, and that to me makes it worth it. We are all in this together, and none of us wants to get COVID-19. Whether it's mild or has potential for severity, no one wants to be sick. So, we've all got to stay home, and we need to do that in order to protect each other, our family, our friends, our neighbors, and our communities.
Going off that, I've seen a lot of sort of testimonials on this, and a lot of people say that it just feels like the common flu, common cold. Can you speak to that and sort of why that can be a bad thing, that people just think, oh, this is just the common flu, but it's not?
So the question is, why could it be a bad thing that this feels like the common cold or the common flu? That can be very difficult because it would not make you think that this is severe. In a normal season of influenza, we expect that we might get a cold, we might get the flu. Sometimes we even come to work when we're sick, even though we maybe shouldn't. So we live in a society where we are expected to continue moving along through our daily business despite maybe being a little bit ill. In this situation, we cannot do that. It is dangerous to our community. If we have any indication that we're sick, we may already be too late for the spread, so we absolutely must be home. And by having everyone at home, it helps to reduce, or at least those that are, that can be relating to the order. It makes it, again, that decreases the spread of this virus so that we can stop the number of cases that we continue to see go up.
And for those looking to volunteer and consider making masks, can you give us the email one more time?
Yes, so the email address is covid19@lacrossecounty.org.
Any hyphens?
Nope.
Okay.
Jen, one common question that we're getting from Facebook is, if I have been in contact with someone that is having symptoms or they live in my home, should I be quarantined too and avoid working?
So the question is, if they have been in contact with someone who has symptoms and they live in their home, should they avoid working? Right now, it depends. If you are a healthcare worker, your employer will guide you on what you are expected to be doing. But most everyone else, we would want you to be home. We would want you to be home because whether it's influenza or the cold or COVID-19, we don't want you to be spreading it, and there's an order that's going into effect at 8 a.m. tomorrow morning that's going to tell you to be home anyways. Okay, thank you all.
Thank you.
Can you go to that?